Hello, ladies and gentlemen, friends from the Freeport Medical Center Facebook, all our patients locally and abroad. I do know that we have patients from as far as Toronto and New York, and I'm sure some of them are logging in today to see our live feed. I'd like to welcome everyone this afternoon to our live feed. As some of you may know that this is a continuation from last week where I started to talk about cancer. This month coming up is World Cancer Month, February, and January month was the WHO, World Health Organization, was recognizing and promoting the awareness of breast cancer and cervical cancer. So, and as a continuum of the cancer talk, today I would like to speak about prostate cancer. Just to formally introduce myself again, I am Dr. Das, the Medical Director and Chief Medical Officer of Freeport Medical Center. We are located in Freeport of Trinidad and Tobago. To introduce this discussion this afternoon, I would like to tell you about a patient who I had recently who came to see me. It was just about 2 weeks ago. This patient, a male patient who was 60 years of age, came to see me because he was unable to pass urine. Of course, I interviewed the patient, and while speaking to him and interviewing him, he informed me that about 2 weeks prior to having this problem, he had difficulty to pass urine, and he found that the stream of urine was slower than normal. In fact, he also found that he was peeing a bit more often than what he's accustomed to, sometimes even waking him up at nights. He also complained that when he goes to pass urine and he takes out his penis to pee, the urine is unable to come out right away, and sometimes you have to wait a minute or two for this urine to flow out. And he also advised me that when he was completed urinating, there will still be some drips of urine soiling his underwear. Ladies and gentlemen, friends, these are some of the main symptoms that you would see in patients or in your family, or some of you who are some of the male patients who are logging on must be aware of that patients or people who has prostate problems would usually present with. So I would like to pay special attention. I would like to ask the male friends and also all our male viewers to pay special attention to these symptoms, because those are the symptoms which would eventually get worse, and then you would then be unable to pass urine. Alright, so prostate cancer, as it is known, it is one of the most common cancers worldwide. In fact, it is the most common cancer in men. It is the second highest cancer after lung cancer worldwide. Right? It affects 230,000 patients. From the statistics that we have from the US, it affects 230,000 patients annually, and they would usually have about 30,000 deaths per year from prostate cancer. In a global statistics point of view, prostate cancer affects 1 in 8 men in their lifespan. So in other words, for your entire lifespan, a man has a chance of 1 in 8 of developing prostate cancer. Some research have shown that it could even be less than that, affecting 1 in 6 men. So really, it's a very serious situation and a very serious problem, and most men should have their screening done to ensure that they have not developed this problem as they get older. In terms of this problem, it presents itself, as I've said before, I'll give you a little bit of medical jargon here now. It presents itself with frequency of urination. That means that you would want to pee more often than you are accustomed to. It will present itself with hesitancy, so that when you go to pass urine, you will be standing there waiting, and the urine will take a few seconds or a minute or so before it starts flowing. You will have a poor stream. The stream is poor, and then you have what we call post-terminal dribble. Dribbling meaning that the urine will then continue to drip in your underclothing after you have finished urinating. In a case like that, what happens is that patients may then develop frequent urinary tract infections, and therefore you will also have burning in your urine, and you will also have sometimes blood in your urine. So those are some of the main symptoms that patients will present. Be that as it may, some and a majority of patients actually will have this problem and will not have any symptoms at all. Hence the reason why it is so important that you have your screening test done as the recommended time and age based on discussions with your doctor. Ladies and gentlemen, friends, viewers, this problem, because it is so serious, we recommend that, and in addition to our institution here, the American Cancer Society recommends that all men from the age of 50 should start having screening for prostate cancer. This screening involves two basic and simple, sometimes a bit uncomfortable tests, but it's a basic and simple test that we advise patients from the age of 50 that they should have. Keeping in mind that prostate cancer is most common from the age of 65 and up, but it can also affect you at a lower age, hence the reason why you start screening from the age of 50. If, however, you have a first degree relative, in other words your father or your brother has this problem, then you would want to start screening at a slightly lower age, perhaps from about 40-45 years of age. Okay, I would like to say hello to some of our friends on Facebook. Amrita Seema. Seema is asking a question about diabetes, and I'd just like to interject here and answer that question, because diabetes is such a very common disease, known as a non-communicable disease, and it is a disease that has a very high morbidity rate. So yes, Seema, we do treat diabetes. We treat all patients with diabetes, and we also do tests for the complications and try to advise patients as to how their general health is progressing, as well as to make recommendations as to what forms of further treatment may be needed for diabetics. All right. In terms of screening, back again to the prostate cancer, it has been also proven in research that prostate cancer is more common in black men. So I just want to make that point, because we in the Caribbean are considered to be black. So we should be even more careful and more proactive in terms of screening. All right. So the two main screening tests that should be done includes a blood test known as a PSA, right? Prostate specific antigen. This is a blood test, and it should read between 0 to 4 nanograms per milliliter. So it's a very low value. This is because this hormone spills over into the blood. So when you take a blood test, it shouldn't cross more than 4. Just keeping in mind that as you get older, the values can increase naturally, and there are other reasons as well why your PSA can increase. So you really have to have a discussion with your doctor when this test is done. For example, prostatitis, prostate infections, enlarged prostate, and so on can also cause elevated PSA. However, if your person has a PSA of over 10, it is at that point you should raise an alarm button and know for sure that you need to get further testing immediately. The second screening test is known as a digital rectal examination, which is a DRE, and a lot of patients, men particularly, are fearful of this examination, and I have to say I have a smile on right now, but it's something which you have to talk to your doctor, let him explain the procedure, let him enlighten you as to what is expected, what he expects to find, and how it is the procedure is performed, and so on, and you may be more inclined to have the test done, right? It is an examination where the doctor inserts a finger into your rectum to feel the prostate gland. When the doctor examines the prostate gland, he is feeling for any swellings, he's feeling for any what we call nodules, and he's also feeling for the texture and the size of the prostate gland. So he's feeling for quite a few things, and this gives him an idea as to whether a patient could have a problem. Also, I have to caution you all again, my dear viewers, that there can be false negatives and false positives. Hence the reason why you have to make sure and see a doctor and let him explain to you this procedure. In addition to that, if a doctor is suspicious after the screening test and he feels a nodule or he feels an abnormal swelling of the prostate gland, he then recommends for a transrectal ultrasound, which is a very sensitive test. It can again, it can then tell you further if there are any suspicion or any lesions on the prostate that can be cancerous. Okay. In addition to these tests, there are other tests that can be done, and I will go into those later on in terms of testing. But those are the 3 main screening tests that we will usually perform in order to help diagnose a prostate cancer. I'd also like to thank my production team, Sherry-Ann and Neil. They have been very helpful setting up the videoing and all of this to have this taping done this afternoon. Alright, so if a patient is suspicious of having a cancer, or if it has been diagnosed, the next step, of course, is to make a definitive diagnosis, and this is done by a biopsy. You all would have remembered last week when I said that if a patient has a breast cancer, you have to do a biopsy. So therefore, similarly, to diagnose the prostate cancer, a patient must have what we call a transrectal biopsy, and this is done by ultrasound guidance. The latest research have shown that it is most accurate and specific if you remove at least 12 samples, and this is done usually by a urologist and also by a intervention radiologist. This test is available at Freeport Medical Center, where we do the biopsy, And this biopsy, removing 12 samples, it is sent to a lab to be tested by a pathologist who will then confirm the diagnosis of prostate cancer. The most common form of prostate cancer is adenocarcinoma, and this is what the doctor will be looking for. Once this diagnosis is confirmed, then we will proceed now to advise the patient as to what forms of treatment that they should have. This before a patient is treated for prostate cancer, it is advisable that they do what we call staging of the cancer in medicine. Staging of the cancer tells us whether the prostate cancer is still within the prostate gland itself, whether it has spread outside of the prostate gland into the lymphatic system or into the surrounding tissues, including the bladder and the rectum, or whether it has gone via the bloodstream into other organs, for example, like into the liver, the lungs, bone, etc. So once this is done, then the recommendation for treatment is made. Right? And there are many different modalities of treatment, including the total removal of the prostate, which is known as a prostatectomy, where a patient's entire prostate is removed. Then you can also give hormone treatment, medication that will prevent the body from producing testosterone. Sometimes surgery is also done to remove the testicles so the patient does not continue to produce testosterone, which stimulates the gland further to cause more problems. Alright? I'm seeing one question from Marcus. I would like to read out this question here. Good day. Keep seeing this on live. I got a question. What you are talking about? What about the better thing to do? Operation?
What's the better thing to do?
Or try to control?
Operation or try to control colitis?
Oh, hello Marcus. Today we are discussing prostate cancer. Colitis is a totally different problem. Marcus is asking how do you treat colitis? Colitis, the treatment for colitis is variable. We use medical treatment for colitis. Of course, if a patient has colitis, you have to ensure that it's not an infective cause. So first you may need antibiotics. You will also need anti-inflammatory drugs, and also you will also need to do an endoscopy to visualize the colon properly to see how severe the colitis is, and then you can gauge your treatment from there. So, but today we are discussing prostate cancer, and I don't want to stray too much from this topic because I have limited time and my time is coming up to almost an end. With regards to treating further, I mentioned already prostate surgery. I also recommend hormone treatment. I would also like to mention, and I didn't mention also, surgery for removal of the testicles. Again, you can also have what we call cryotherapy, and that's where you try to burn the cancer cells. There are other modalities of treatment, including radiation therapy. Radiation therapy, again, where is a high frequency rays directed directly on the prostate to focus on the cancer cells and try to burn these cells so that you can kill off these cancer cells. And of course, if the cancer has spread outside of the prostate into the liver and lungs and so on, then you have to do chemotherapy. Chemotherapy is where you inject the medication into the veins of the patient, and that will be transported to the cancer cells where they're located, and it will try to deal with those cells at that point, at that place. A few other important things to note about prostate cancer. Prostate cancer there are some predisposition factors that we should know about, and A lack of exercise has been said that could cause it. Smoking could contribute. Lack of exercise, smoking, a high sedentary lifestyle, eating food high in cholesterol, example red meats, etc. And some of the foods that you would probably want to have on a regular basis, men for example, would want to ensure that they have tomato, because it contains ingredients that helps to, it has been shown or postulated that these can help to some degree with prostate cancer problems. All right. I'm seeing another question coming in. Let's pause for a second. This is coming from Ravi. Good day, doctor. Does having an enlarged prostate means that there is a higher risk of getting prostate cancer? That's an excellent point, I must say, Ravi. Hello to Ravi. An enlarged prostate in itself is not a diagnosis of prostate cancer. In fact, it does not mean that you will have prostate cancer, and it does not mean that you will be more at risk of developing prostate cancer. In fact, the most common cause of enlarged prostate would be BPH, which is known as bilateral prostatic hypertrophy, which is a condition that happens in men as you get older. It's a natural progression which causes your prostate to enlarge as you get older. So it does not mean that. Hence the reason why you need to get the screening test, which is the DRE and the PSA test by a doctor, and then a further test known as a transrectal ultrasound will check. If there is suspicion after these tests, then you need to do the prostate biopsy. Very good question, Ravi. Very good. Another question is coming in from Sunita. Hello, Sunita. Great information thus far. What about blood in the urine? That's also a very important question. Prostate cancer definitely can cause blood in your urine, definitely. But as a medical physician, what we do is we screen the patients to see particularly which age group, what class of patients, and what problems that will most likely cause blood on that particular patient. And male patients over the age of 50, of course, prostate cancer will definitely be one of the main diagnoses that we will be focusing on. However, there are other diagnoses that we would like to check on, and that would be, for example, urinary tract infections, which can also cause blood. We'll also want to check on enlarged prostate. Very commonly, stone in your kidney or bladder can cause could cause blood in the urine, as well as tumors of your bladder or kidney. Because of the tumor in the kidney or bladder, it bleeds, and that blood then comes down into your urine. So there are other causes of blood in the urine. So this again, you have to see your doctor, and test has to be done. As I start wrapping up now, I would just like to say that there are other tests that are important and must be done if a patient has been diagnosed with prostate cancer, and that would include a CT scan of your pelvis and abdomen to check for spread outside of the pelvis. It will also check the bones, check your bladder, check your pelvic floor, and of course what we call an MRI scan of the pelvis to check your lymph nodes to see if they are spread to your lymph nodes. So these things have to be these tests have to be recommended by a doctor, who of course will then make the particular recommendations. All right, I would like to say to all our viewers that all the tests that we have mentioned thus far, including the CT scanning, are available at Freeport Medical Center. The blood tests, the DRE, which is done, I will be doing these DREs. The ultrasound, transrectal ultrasound is available here, our CT scan and the blood test. All of these are available at Freeport Medical Center. You can get our contact information, which is available at on our Facebook page and to make an appointment for any of these tests. Just to repeat, I would like to remind you all that these live feeds are coming to you as a part of our 10-year celebration at Freeport Medical Center. We are really happy to be functioning and operating and helping many thousands of people. In fact, our register have shown that we have over 30,000 patients at Freeport Medical Center. So we are celebrating our 10th year anniversary in the month of February, and as such we would like to inform and give back to our community and our country, and of course the wider population base throughout the world. And feel free to post up any questions that you may have for me, and I will be happy to answer these questions. I would also like to make an announcement that as part of our celebration, we will also be participating in a health fair at the Monroe Road Government School on the 12th of February. We will have a full team there, including a doctor, nurse, our marketing personnel. We will have a full team doing screening for different problems, different medical problems, pressure, sugar. Free doctor visits will be available, advice to the public, and all patients will be given. So I'd like to invite everyone who would like to come to this free clinic on the 12th of February on Monroe Road, starting at 8 a.m. in the morning. Thank you all. Thanks everyone for viewing, and I will be on again next week, Monday, and we look forward to having another discussion. Sherry Ann will inform you all as to what topic will be discussed, and I'll be on again on next week. Thank you very much. Bye. Bye.